आईपिल खाने से अबॉर्शन हो जाता है क्या? Why do all doctors say this is bad? How does it even work? How can you have sex, have a pill, and then not get pregnant? Hi, my name is Dr. Tanya. You probably know me better as Dr. Cuterus, and today I am here to tell you all about emergency contraception. Emergency contraception is exactly what it sounds like. It's meant to be used in an emergency, and it is contraception, which means it prevents conception, which means it prevents a pregnancy. Contra means against, so if you're going against conception, you're doing contraception, and you might need to use this a lot of times. For example, in case you've used a condom, broken the condom, forgot to use a condom, in case your birth control has failed, and unfortunately even for non-consensual sexual acts. Emergency contraception is very important and very, very useful, but it's very important to not abuse emergency contraception. So let's learn what it is, how it works, and what are the side effects. There are two kinds of emergency contraceptions available in India. The first is an IUD or an intrauterine device, which basically is what it sounds like. So an intrauterine device is a small T-shaped device that sits inside your uterus. The uterus is the cavity where the baby would normally be. If you don't want this to happen and you want an emergency contraception, you can use an intrauterine device which will sit inside here and prevent this baby from being formed. The second emergency contraceptive option that's available is hormonal pills. Now I do understand that not everybody is able to go to a doctor, get an IUD right away, and this can be, quite a hassle. Bearing in mind that IUDs are the most effective form of emergency contraception, you can also use hormonal pills. Now these hormonal pills act in multiple different ways. So on the sides of the uterus, you've got the ovaries. The ovaries make and release the eggs every month, and when the egg and the sperm fuse together, you get a cute little baby. If you can prevent this egg from being released in the first place, that will prevent that egg going on a date with that sperm, fusing and making a baby. So the first thing that emergency contraception does is that it delays or it prevents this egg from being released. The second way it can work is that even if the egg does go out on a date with the sperm, it will prevent it from latching on when the combined product of that date happens, the fetus or the embryo. It will prevent this embryo from latching on the inside lining of the uterus. This is called implantation. So essentially, you will not let the couple come back home after a date. And this is how emergency contraceptions can prevent a pregnancy. Now, emergency contraceptive pills, on the other hand, they can have a range of side effects ranging from tender and sore boobs to irregular bleeding. A lot of people experience bleeding right after being on an emergency contraceptive pill. So, you're expecting your period in 3 weeks, but you get your period right away. This is one of the ways the pill works. So, this is also normal. Aside from this, you may also experience nausea, which is wanting to vomit all the time. Or you can experience headaches. Some people even have slight allergic reactions. If this is something that's happening to you run to the doctor.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.